The Center for Disease Control, the federal government of Nigeria, and other stakeholders has organized a two-day fourth biannual conference on stakeholders' engagement on improving public health program through service. The conference, which had Catholic Caritas Foundation of Nigeria as its implementing partners, was held in Abuja and provided an opportunity for stakeholders to review and discuss progress, challenges, and future strategies in combating HIV/AIDS in Nigeria. CTV News Tony Abba completes the report.
And justice shall reign.
Gathered in this hall are health professionals, policymakers, community leaders, and other key stakeholders. They are here for the fourth biannual stakeholder engagement meeting organized by the Center for Disease Control and Prevention, CDC Nigeria, to review progress, challenges, and future strategies in combating HIV/AIDS in the country.
I'm excited to be part of this fourth biannual stakeholders engagement meeting organized by the CDC Nigeria. I understand that the main thrust of this meeting is to facilitate review through knowledge sharing of different experiences by implementers from both the national and various subnational levels. I must commend and appreciate CDC for their sustained efforts and support to the country. It is indeed an available partnership, especially considering the areas of focus for intervention. These are central to the well-being of the citizens, as it includes disease outbreak preparedness, immunization, HIV epidemic, and so on.
Government of America, through these programs, over these years, in the 19 states of this federation and more, are investing resources to ensure that the simple person, the simple man and woman infected with this disease will no longer die but live. Well, remember, in the year 2000, how devastating it was. HIV was a death sentence. People were dying like flies, were handicapped, were vulnerable. The government could not do anything about it until we rescue came. And we began to see enormous improvement. And today, it is no longer a death sentence. It has become a disease like any other disease around us. And it may not be totally cured, but the viral load, when it's suppressed, when it is untransmittable, from what I heard from my professors, then you cannot also be infected. That means then that people can honorably live their lives, their full span, when they attend to their medications.
This gathering offers a veritable opportunity for experts to compare notes on the best way to prevent the scourge of HIV/AIDS in Nigeria.
Our principals, the executive governors of our various states. 2 years ago, we started this journey. And we've implemented so many programs and projects under the HIV and health security and other programs. We enjoyed this partnership, we enjoyed the collaboration with CDC, and there's this resultant improvement in all our states as is exhibited on our scorecards. I want to therefore say that the journey has been quite impactful and very fruitful.
Capture is what's really important, and I know over recent weeks, over the weeks to come, everyone's going to have so many things to say about Dr. Boyd, but I just want to be able to say that how much I have appreciated, how much the embassy team has appreciated, how much you all have appreciated the contributions that she has made.
The theme of this edition is improving the public health program through science. And as we all know, the public health is an evolving area. What we see today becomes obsolete tomorrow, and the new evidence comes, which helps us to design program and address to all the public health issues that occurs not only in Nigeria but also at the global level as well. And here at the global level as well in Nigeria, we truly depend on CDC's work with the government but also with the partners as well.
The United Nations Agency for the Control of AIDS, UNAIDS, has put the prevalent rate of HIV/AIDS in Nigeria as 1.4%. Experts believe that a lot still needs to be done to have an HIV/AIDS-free Nigeria.
So we're going to intensify our activities in the states where we're working, especially in communities that are underserved and far to reach, where we find that people are in need, especially infected persons who are suffering from certain shyness, of not accepting the fact that they have HIV for them, and then assist them, because the drugs are given free, and we encourage them to take their drugs and assure them that when they do that, they will be able to live their full lives.
Target of 95, 95% of the general population that HIV status. 95% of that population should be access education. Trying to achieve this target
some time, CDC will leave Nigeria. So if they do, what is Nigeria or at the subnational level? What are our plans to sustain this program supported what CDC is doing? So this meeting will give us an insight as to what we need to do, how we're doing it, and what gaps are there for us to bridge.
In Abuja, Tony Abba, CTV News.